we will begin to learn about procedural sedation and how we will use it and document. As of right now, we are not following the policy for this, and in the past, it has also been referred to as conscious sedation, as some of us may recognize it. We'll talk about the medications that qualify as procedural sedation, other documentations that we need to be aware of, and how to document in the Sedation Navigator. What is procedural sedation? Anytime we give a medicine that causes some kind of sedation or pain control, any bedside procedure that we do, like non-emergent intubations, art lines, bronchs, etc. Also, if we increase a drip that we already have infusing, like propofol, if we give a bolus of that, that also qualifies as procedural sedation. These are the meds that we commonly use. We are pretty familiar with these already. We also have to be conscious of the reversal drugs just in case there's an emergency situation. Like the next few slides will go little screenshots of stuff that we will have to be documenting on. You can kind of see what questions they will ask. We will be looking at the timeout, screenshot, sleep apnea, fire safety, and the pre, intra, and post-procedure documentation. We will mostly be focusing on using the Sedation Navigator. It is very similar to the Rapid Response Navigator, Code Blue Navigator, and the Stroke Navigator. But there is also a way to do this documentation through flow sheets. If you click on your flow sheets and search procedural sedation, you'll find all this stuff there too. This is the sleep apnea questionnaire called the Stop Bang questionnaire. This is something that will pop up in the Navigator. Go ahead and take a look at some of those questions to familiarize yourself with that. This is the timeout questionnaire and the fire risk screening. Please familiarize yourself with some of those questions. So here I will show you in the Epic Playground how to get to the Sedation Navigator and kind of things that are here. If you go to this little arrow here, usually you have to slide all the way down, and it says sedation. I'll bring you to this screen here. Here I've already started sedation documentation start. You add your staff, and then we would start with we go down this column here and start with our pre-procedure documentation. Your pre-procedure checklist. We're pretty familiar with this, but I'll kind of fill things out really quick here just to kind of get through it. I won't get too specific. Just saying yes to everything. Okay. And then once you accept all that, it will bring it into your Navigator, and it also puts a nice little check mark on the side here so you know it's done. This is where you will find that sleep apnea questionnaire that I showed earlier. These are your vitals that you can enter in before the actual sedation starts. An assessment, just fill out all the stuff the best you can. After that, you'll go to your timeout. This is where we do the fire risk safety timeout and the actual timeout where we're doing the correct patient, correct procedure, yes, site markings if applicable, consent, etc. Again, once you accept that, sorry, I can't get rid of this little guy here, sorry. That will go into your Navigator as well. And again, another check mark. Into your intra procedure, this is where you will put your medication, you gave your medication and started. And this should coincide with the medicine you give, which you can come to the left side here and go to your one-stop medications. This you will find your fentanyl, Versed, propofol, and then also if there are any drips on this side as well. I went over here and did my pain and Ramsey vital signs.
As you can see down below here, it starts a timer and it tells you when your next assessment is due. During the intro procedure, it's vital signs Q5 and pain Q15. This is where you can document the procedure end and also your post-procedure, your vitals as well, which for post-procedure, it's Q15 vitals, Q15 pain assessments until they have met their discharge, recovery, or they're back to baseline. Just to kind of speed things up, I documented my sedation documentation end. Obviously, we'll be going through this whole column here, is doing as best as we can to chart whatever we can. This will be kind of an ongoing thing. We're all going to be learning this all together. It's new for all of us, so I will answer his questions as much as I can. We also have the ER as resources. They also do this at their bedside procedures as well. I will I will have a whole binder full of resources for this procedural sedation. There will be some scenarios in the binder that we can hop on to the Epic playground and kind of practice this stuff if need be.